All right, Paul Rosen, I've been doing some reading this morning about the hot air balloon world. How about that? Here's an interesting fact.
That's really something. I
It's
just
pretty
can't wait.
esoteric, but here's an interesting fact. A woman in 1895 she was the oldest person ever to fly in a hot air balloon. She was up in the air for about an hour. Her name was Emma Carroll. And at the time of her trip on a hot air balloon, she was 109 years old. How about that? That's
Amazing.
pretty impressive. I think that's pretty cool. Also in 2002, a British guy made the highest bungee jump ever. He went up in a hot air balloon about 3 miles above the surface of the earth and made a successful bungee jump from there. And here's something too. If you have an extra $6.5 million laying around, do you have $6.5 million for your next vacation? Of
Oh,
course you
yeah,
do.
yeah, underneath a rock in my
For
yard.
that price, you and a guest can take a hot air balloon over the tip of Mount Everest. How about that? You
For
get to
six
take
and
a
a half
guest
mil?
for 6.5 mil.
Wow.
Plus,
You
I think
gotta
you get,
you gotta have some
well, that includes beverages and probably a snack tray, I imagine.
beverages? I don't think so.
Anyway, these are some of the highs. These are some of the highs of the hot air ballooning world, and the highs of health are what we're talking about this morning on Health Matters with Paul Rosen. There you go.
Finally.
You were waiting for me
Finally.
to get to the point, weren't you? I think it's
Well,
fascinating information, but we have
yes,
better,
it
more
is. It
fascinating
is.
information.
Serving drinks at, 25,000 feet above
Well, I
sea
don't
level.
know. I don't know if that's true or not. I don't know if you get beverages. You may be on your own with that. I mean, 6.5 million, what do you expect? They just give you the ride. Everything else is up to you.
Right, it'd have to be gasoline or something.
I have no idea. More to the point, get healthy at AccuNatural.com is the address to which you can write to Paul Rosen for any health question you may have on your mind. Get healthy at AccuNatural, ACUnatural.com. Also go to AccuNatural.com 24/7 for excellent health advice. And I did say 24/7. My voice went up there an octave for a second. I don't know why that happened, but it
Because it's
did.
too high.
I guess so. There you
Yeah,
go.
yeah,
There you go. I was
yeah.
speaking to our point once again.
Once again, I mean, it's you're tuned in.
Yeah, I'm always on target. By the way, you
Also,
can
oh, go ahead.
what? Oh,
Yeah, no,
one more point to make. You can
yeah.
also see Paul on Facebook. Just go to AccuNatural Family Healthcare, and you're also on YouTube because that's the kind of guy you are. You are everywhere, reaching out to help people get to a better state of health.
This show is podcasted, folks. Any platform. Of course, you can go to my the website AccuNatural.com and click on it there. And starting at the end of this week, that will be your central, shall we say, touch point for further podcasts, because Rod and I are leaving the air on KUFO. We thank them very much for all of the wonderful things that they did for us. But we will still be providing pertinent, effective information for people via podcast. And that can be accessed at any time on any one of your devices. And we hope you avail yourself of that. And okay,
I think you've gone ahead and spread the word on that. And
Yeah.
again, all you have to do is go to Facebook or go to YouTube or any social media platform you prefer, and you can find this audio. You can find more information about AccuNatural Family Healthcare and all the good things it can do for you. Okay, the two highs of health. That's what
There's
you were
no better
calling it.
time to tame the two highs: too high cholesterol, too high blood pressure, and too high blood sugar. Would you like to learn how, using safe, natural, and effective methods, of course? And then we'll hear from Colleen, patient of mine, who was experiencing several of these two highs, and she'll be relating her adventure back to good health, resolving these satisfactorily. So, you know, the too high cholesterol thing, we could probably spend 3 shows or longer on this. But here's what I want to say specifically about, too high cholesterol. In general, if you just take your cholesterol levels, they fail to be useful with respect to predicting whether or not you will experience heart disease or whether or not you will succumb to heart disease. As I have shared with you folks many times, the body, your liver produces 75% or so of the cholesterol in your body, and of course, and what is circulating within your body. 75%, meaning that the food you eat accounts for 25%. And so the issue then is, if your total cholesterol is not indicative of what you may experience with respect to heart issues, and the supermajority of the cholesterol is actually produced by your own body, the only way you can control that cholesterol is, number one, to keep that body functioning properly. And number two, to basically take a look at what you're eating. And it turns out that what you put in your mouth really counts. And the foods that you need to avoid are the sweeteners, excess concentrated sweeteners of any kind, including fruit, meaning fruit sugars and fruit juices and concentrates and those types of things, as well as any other kind of sweetener other than stevia, in some cases an oriental fruit called lohan. Otherwise, even the alcohol sugars like erythritol, malitol, xylitol, many people do not tolerate them. Of course, the way to find out is to get tested, but in lieu of that, you can avoid it. Best product for stevia, Trader Joe's carries a nice organic powdered and liquid stevia that works.
So
really
all these
well.
principles you're talking about, Paul, avoiding sweeteners in particular, except for the ones you've outlined, did these relate directly to maintaining a good cholesterol level?
Yes. Yeah.
Okay,
Mhm.
so what is a
So
good
in addition
cholesterol?
to that, in addition to the sweeteners, of course, all refined foods, generally speaking, the overwhelming majority of packaged foods, whether it's organic or not, whether it's gluten-free or not. Interesting, huh?
Yeah, that is interesting because we've all bought into I shouldn't say we've all, I should say many have bought into the gluten-free thing. So they think if they're avoiding glutens, maybe not even knowing how to define what a gluten is, they're doing themselves some good, and maybe even specifically in terms of their cholesterol levels.
Yeah. And of course, everything I'm saying regarding cholesterol can be applied both to high blood sugar and high blood pressure as well.
So can we go over some of these things and kind of figure out why they're good or bad? For example, high cholesterol, is that really a thing? And is it something we should be concerned about?
For generally speaking, high cholesterol is not the story that Western medicine would have you believe.
So here's the story we've been taught. It includes one element, which is that if we eat eggs, we'll have high cholesterol, and therefore we're presenting a danger to our hearts because we'll clog our arteries. True or false?
Debunked.
So that's a false one.
Yeah.
Okay. So why then should we worry about high cholesterol? What impact can it have on our bodies?
Well, I mean, cholesterol tends to be a thick, waxy substance. And obviously, if there is too much circulating in your bloodstream, you can end up with occlusions or blockages. But the question is what's too high? And the people that I trust, the people that have helped me and educated me to helping others with these too highs, right, will often talk about a total cholesterol level of between 180 and 200 plus your age.
Okay, so I'm 59. So let's say, so for me, doing the math on that quickly, 180 plus 59 equals 239. So if I go into a medical professional and they tell me that's my cholesterol level, and am I within an acceptable range at that point? And what does that number mean anyway? Say
Well,
180 to whatever. Well, you see what I'm saying? I'm trying to create an
yeah,
example.
yeah. I mean, if you're asking me, a non-Western medical doctor, um, I would say your cholesterol's just fine, thank you.
Okay, well that's
Based
good.
on based on the information I have and what I've been trained on.
And let's say it's really high by the measurement we're using. Say in the example we gave, 180 plus 59 is okay, but let's say my cholesterol is 400 or some outrageous
That's a different
number.
story. Then you have to start looking. Of course, first you want to check the diet, but there is a small fraction of the population that is subject to an hereditary hypercholesterolemic. Say that 3 times really fast.
I can't say it once, so it's entirely on you for that one.
Condition. And so in that case, yeah, maybe some intervention, would be useful.
So at that point,
the
what
use of
kind of
statin drugs, the use of statin drugs today is, akin to the overuse of antibiotics. It just simply you're not gaining what you think you're gaining if you take a statin drug.
the two highs of health, including cholesterol that's too high. That's our topic of discussion this morning on Health Matters with Paul Rosen. Get healthy at AccuNatural.com. Get healthy at ACUNatural.com. So statin drugs, this is the point I was going to get to, Paul. If I have, or anybody has, cholesterol that's determined to be way too high, why statin drugs? Why are they prescribed?
Well, statin drugs have shown in some instances to lower your cholesterol. But diet can lower your cholesterol significantly if it is associated with a program, a strategy that addresses the other factors, of your condition.
So earlier you outlined the fact that we should cut down on sweeteners and processed foods. That will, of course, have a positive impact on our cholesterol levels.
Always does.
But do we
Always
have,
does.
that's the broad picture, that's the macro view, but do we have to do more specific things based on individual needs?
Yes, which is why coming and getting a nutritional healing program, finding out what your personally unique characteristics and requirements are. It's essential. It's essential to address any of these 3 conditions. So, it's not what I want. It's the rules of the game, right? If you have too high cholesterol, if you have too high blood pressure, if you have too high blood sugar, whatever you're doing isn't working. It isn't working. But that doesn't mean that the first option is necessarily medications, because as you know, there's no such thing as a medication that doesn't have some side effect. And we say side effect like it's, a little thing off in the distance. Side effects can be extremely disruptive and create ultimately the breakdown of some organ or gland in your body. So, side effects is, I think, is a misunderstood term, really.
Yeah, I think when many think of that term, they're thinking in terms of fairly minor things.
Yeah,
as
like a
opposed
mild something of this or that, which is couldn't be farther from the truth.
Right. So you could create further health problems just
Statin
by
drugs are known for destroying liver tissue. Why on earth would you take a statin drug for, questionably a cholesterol number which is greater than you're 180 plus your age, right? Which might reduce your chance of heart disease or morbidity due to a coronary condition by, I don't know, could be anywhere from 2 to 5%. Take the chance of irreversibly destroying your liver utilizing a statin drug over an extended period of time.
So
Why
as
would
I've
you
heard,
do that?
well, I don't think anybody would do it intentionally. And maybe, I don't know, when you're prescribed statin drugs, you may be warned that certain side effects are possible.
Yeah, but any medication you're given, you're warned, or you're said, oh, make sure to go look up this, the side effects of this and everything else. But people don't, people don't go, oh yes, I will check that out. They tend to just take it and run with it.
Yeah, I think you're right.
Proof is my clinic.
I think you're right. I think, you've had those experiences in your clinic. I think many patients, and maybe I won't exclude myself from this, you hear the word side effects and it just bounces off because it's one of those that will happen to the other guy things. That's what you're thinking. That won't happen to me.
Well,
I'm not going to have.
I don't even know if it's that conscious. That might happen to the other guy, not me. It's just, you just do it. You don't even think about it. But it's really important because it turns out that these 3 too high conditions are absolutely addressable using safe, natural, and effective methods. You folks just have to be willing to make the lifestyle changes that are required to get this done. And I'm talking to people who already have these conditions right now, or to people who want to avoid having them altogether.
High blood pressure, high blood sugar, and of course, high cholesterol levels are our topics this morning on Health Matters with Paul Rosen. You can reach Paul directly anytime at gethealthy@acunatural.com, gethealthy@acunatural.com. Also go to acunatural.com for podcast editions of this program. Paul's also on Facebook and on YouTube. But as it's possible to have 2 high levels of blood pressure or cholesterol, Paul, is it possible for those to be too low also?
Absolutely. Absolutely. Remember, we just talked about this last week. Cholesterol is absolutely essential for making all of the hormones in your body. Cholesterol is essential for the maintenance and making of all of the human cell walls in your body. Cholesterol is absolutely essential for sustaining a healthy brain. And saturated fat plays a significant role, the consumption of saturated fat. Good saturated fat plays a significant role in satisfying the requirements I just laid out.
So there you go to that counterintuitive thought again. I think many of us would automatically assume, well, if I have high blood pressure or high cholesterol, I need to cut down on fat because those are the things that will exacerbate those conditions. True or false?
I will tell you in every instance, any patient who has ever come to me with one or more of those conditions, I have increased their fat consumption. Everyone.
Because fat is essential for maintaining a healthy balance.
As
is that
I laid
right?
out. Yeah,
okay.
As I laid out. And yes, that may seem counterintuitive, but that's only because it runs counter to the propaganda that Western medicine and the practitioners have propagated and misunderstand the whole condition. They've based it on studies going all the way back to the 1950s, which were really, they've been proven to be false. But you know what they say about a runaway train.
What do they say about a runaway train? What do they say about it?
Knew.
No, I'm waiting for the punchline.
What? A runaway train, ain't got no brain.
Okay. Well, okay. I was going to give you a rim shot if it was funny, but no. A runaway train ain't got no brain. I was waiting for a joke. I thought you were going into your stand-up routine. You know what they say about a runaway train? Anyway,
Too early in
yeah.
the day.
Okay. Well, it's never too early for a good joke. Do these things, by the way, high blood pressure, high cholesterol, high blood sugar, do they tend to run in tandem with each other? If you have one, will you
Oftentimes.
necessarily? Okay.
Yeah. Yeah.
If you have
Oftentimes.
one, you'll likely have
Because
the other.
yeah, because at the center of this is your liver. And so, um, uh, flanked by adrenals and thyroid. Shocking, right?
Yeah, those are all familiar terms. It seems
Yeah.
like
So
whenever,
maintaining health, requires maintaining, those three things amongst others. And so, what you put in your mouth is really important, along with the environmental concerns, chemicals and metals and ongoing immune challenges and so forth. And these things need to be identified because anybody who has any of these too high conditions has one or more of those environmental impingements or obstructions ongoing.
and not to
So
be
just changing your diet is, of course, wonderful and useful, but it may not get the job done satisfactorily.
at the risk of being melodramatic, can these conditions, such as high blood pressure or high cholesterol, be fatal?
Ultimately, sure.
That's pretty horrifying. If you're not taking care of these things. And I assume if you're having symptoms related to these conditions, obviously your health is not good. You may be fatigued, you may be lethargic, you may just be not feeling well. Is that
Well,
correct?
if you're prescribed a medication, you may be of the mistaken impression that your life goes on and everything is okay. I mean, I've seen it. I've seen people come in and their goal is to lose weight. They don't even put on their intake form the fact they've got high blood pressure or high blood sugar.
Why is that? Did they think the medication is taking care of that by itself?
Yeah, because they're taking medications and they are under the impression that it's being managed.
Well, if that's the case, if they're not really even telling you about it when they go in for help, are they just assuming the medications have handled the problem?
Yes.
But
Mistakenly.
they must be getting some relief then. Their
Oh yeah. Well, I
medication
mean,
must be doing
there are
them some
plenty of
good.
there are tens of millions of people taking a blood pressure lowering drug that's that seems to be working. But the problem is most of those blood pressure lowering drugs have potentially serious side effects.
And so I would assume that's more the case with somebody who's taking medications over a long period of time, over the course of years, maybe. You're probably getting a
It can
placebo
happen.
effect.
It can happen sooner than you think.
All right. So
So,
that's
so,
something to watch
so
out
just
for.
again, want to remind folks that if you found these shows useful to you, educational or comforting, or even on the other hand, even slightly disturbing, to the degree that you would do something about it, we will not be on KUFO starting this next weekend. All right, Saturday, I guess, is our last show, but we will be available on all of the platforms, including YouTube and other podcasting platforms. You can go to our website, AcuNatural, acunatural.com, and there's all the platforms are on there. You can click, you can access the information and these shows at any time that's convenient for you on any device, electronic device, your phone, computer, iPad, whatnot. So do not fear.
It's easier than ever to get information. That's one
Easy,
good thing about living in a
simple.
wired world. And of course, you can always write to Paul any old time. Get healthy at AcuNatural. Get healthy at AcuNatural.com is what I meant to say. Get healthy at AcuNatural.com. And as Paul just indicated, podcast editions of the show are also at the website, AcuNatural.com. So you've been able to help many people over the years, Paul. You speak from experience when you're talking about these issues.
Yes. That's totally true. Over 27 years worth. Colleen, a patient of mine, had several of these two highs, and she made her way to me, and I evaluated her using the nutrition response testing technology, and she agreed. She was ready. She was willing. She was able. She agreed to begin her adventure back to health. Let's listen to Colleen.
So I'm going to get right to it. By the way, didn't you come to a talk?
I did, absolutely. I had found out that my daughter-in-law went to one. They said, "Oh, why didn't you tell me? I want to go hear that guy." I've heard him on the radio, so I finally went to you back in April.
It was in April, right? And you came to a talk, and what was it like for you? What did you hear that inspired you to actually take a step and come and see me?
Well, I just heard that I didn't want to be on any modern medicine, and I wanted to be free from all of that and be well.
What were you looking for help with?
Well, I had been taking cholesterol medicine, and I had also been taking high blood pressure medicine and something Prilosec type of medicine for acid reflux, sort of. And I don't want to take any of those. I don't want to depend on medicine. I want to be just healthy.
And it took. I mean, how long had you been taking those medications, Colleen?
Well, actually, the doctor put me on those. It was probably about 8 years ago when I made a trip to Europe, and I found out before I went that I had a heart condition, and he told me I needed to stay home and go to a cardiologist. And I said, no, I'm going to be on that plane Monday morning. So I went, and he gave me the medicine. I started taking it.
And what was the heart condition, if you don't mind my
asking? It's kind of just a minimal thing where the left ventricle doesn't close properly after exercise.
Mm-hmm.
But because I had this acid reflux condition, they thought maybe they detected a heart problem, so I had to do hundreds of tests. And that's all they found out. So it really doesn't bother me, and that probably wasn't what was affecting my acid reflux.
Oh, for certain.
Absolutely.
Yeah.
Absolutely.
Yeah. And for those folks who want to know a little bit about muscle testing, of course, you can go to my website, AcuNatural, acunatural.com, and it's described there. Of course, you can get a copy of my book, The Great Health Heist, which I know you've read some of, maybe all of it, I don't know.
Absolutely. I've read the whole thing.
Interesting.
The first 77 pages a number of times.
Interesting.
Yes.
That's Colleen, Paul's patient on Health Matters with Paul Rosen, talking about her various issues. We're talking about the two highs of health: high blood pressure, high blood sugar, and high cholesterol. Get healthy at AcuNatural.com. Get healthy at AcuNatural.com. She addressed specifically, Colleen did, her issues with her blood pressure medication.
She did. And the interesting thing, that she said was about not wanting to take, these medications, and that her blood pressure was 138 over
80.
I forget what she said. Was
she
80
said 80.
Or something like
yep,
that?
138 over 80.
And she's a mature woman. That is to say, she's older. She's not younger. She's not an athlete. For an individual, over 60, 55, 60 with a blood pressure of 138 over 80 is like absolutely no reason to give a medication. None.
So why was she on the medication? Was she a little
Well,
bit high,
I'm not saying, remember, I'm not a medical doctor.
Okay.
Right. And the information that I source doesn't abide by the standard of care according to Western medicine. But the bottom line is ultimately we're able to get her off all of the medication, and she's doing quite well. So, why incur a side effect which is not necessary? I mean, and why would you set a standard which you say is a normal blood pressure, making the same standard for a 25-year-old Olympic athlete or a 60-year-old grandmother? Why on earth would their blood pressures be be adhered to by the with the same standard. Does that make sense to you?
No, it does not at all. But is that the
So,
case?
yeah,
I mean,
of
are
course it
are
is.
they looking for a standard set of numbers for such a broad
Those are
range?
the standard set of numbers, right? Anything over 140 on top, anything creeping up to 90, 140 over 90 is the limit.
And they don't take into account your age or other
Or
factors.
your weight or which just doesn't make any logical sense. Where's the proof? Where's the evidence? Where's the evidence?
Well,
And as
point
soon as they
being-
show it to me, I'm on board. I'm an evidence-driven guy.
Right. But point being, I think above all with all these conditions is you wish to avoid medications if you can, and it sounds like it's possible.
Yeah.
Okay.
Yep.
I was waiting for
Somebody
the
sent me an
affirmative.
email.
Oh,
So
okay.
I was doing an email while we were talking.
I could tell you were distracted.
Yeah.
But,
I was what do you call it? Double tasking. What do you
multitasking.
multitasking?
Multitasking. You were so absorbed you even forgot the term for what you were doing.
Colleen, part 2, quickly.
Okay. Well,
Get me off the
yeah,
hook.
I guess we better get to that. Here's Colleen, Paul's patient, and she's talking about her road to better health.
The testing revealed your personal nutritional deficiencies and barriers to healing, and some of those barriers included some food sensitivities, and it was recommended to you that you stop eating some foods.
Absolutely.
And what were those for you?
Well, all grains.
Oh my gosh.
And I said, oh, no, my oatmeal's gone in the morning. And, of course, then fruit and sugar of any kind. And and I'm not really a sugar freak, except I like to make chocolate, and I don't have chocolate anymore.
And why not, hon? I mean, that's, I'm a chocoholic myself, and I haven't had a piece of chocolate in probably, 15 years. And do I miss it? Yes, absolutely. But what don't I miss? What don't you miss?
Well, I don't miss, number one, I think the sugars are maybe what caused, forgot to tell you that I had this mucus situation in my throat.
Oh, that's right, that chronic sort of mucus, yeah.
Absolutely, and I don't have that anymore. And I just think it has to be sugar related. And, of course, grains basically turn to sugar in your system, so it's all related.
Yeah, and the other thing, too, is the one of the things that you were very, very sensitive to was soy. And, of course, the big problem there is that soy, unfortunately, is cross-contaminated. It's crossed in so many of the other grain products, and you came to learn that.
Well, and yes, and of course, I'd been reading labels for a long time, but didn't realize that soy wasn't a product that we should be eating. And then I see it's in every single thing that you pick up.
Exactly.
It's rare you find something that does not have soy.
And soy is something that you needed to avoid absolutely like crazy. Have you, you were so good about making the changes. I don't recall, I know, but many patients get exposed to a food that they're supposed to avoid, and they have a reaction to it and sort of reminds them why it was they were supposed to avoid it. Has that happened to you at any point?
Well, it has, because once in a while like I told you before, I was in California and my kids were all eating these wonderful strawberries, so I had to have about 3 strawberries, and was within just minutes that I started having this mucus again on my throat.
Isn't that interesting?
Yeah, and so and I have a plum tree next door, and once in a while I pick up one of those and take a bite, and I think, oh, I should not do that. Get rid of it right away, but...
And that mucus thing is a food reaction. It is a food sensitivity reaction. And I know many people who are taking drugs in order to deal with that, and yet it was a very simple process of identifying certain foods for you that were creating these issues. And of course, this one was this chronic mucus thing. And how wonderful is it to know that you're in control?
Oh, it's just great. The reason I continue to do what I do is because I know I feel good, and I don't want to feel like I did before, and I don't want to have to resort to Western medicine,
So what results, you made the changes. Those were the food changes. You were also taking some supplements to address a few of the barriers to healing. I think you had an immune challenge, and I know we provided some enzymes to begin the process of strengthening and your digestive system. And so what results?
Well, the results are, I feel so much better, and I don't have the acid reflux anymore. And I also had a problem with constipation a lot. I don't have that problem anymore. And I just felt great. And the first week, I felt like a new person. I told everybody I know, man, I've been going to see this guy, and he's given me these supplements and taking me off of all this stuff, and I feel wonderful.
That's amazing. In 1 week, you lucky person. Boy, it took me a long time.
Yeah, But like I told you, I thought I was a pretty healthy person, and it felt pretty good to begin with. But just these little small issues are not fun to deal with every day.
Right, and you were a pretty healthy person, but these things were the beginnings of that health deteriorating, and being 39 years old as you are.
Yeah, absolutely.
Yeah. These are the things that start to take down the quality of your life, and many people your age, and many people your age. How many medications are they on?
Oh, at least 5 or 6.
Exactly,
if not more.
Exactly, and they're and more often than not, they're complaining about their health to you.
Absolutely.
And when you say
you want to get well, you just have to change your eating habits and go see somebody that can help you out.
Exactly right.
That's part 2 of Colleen's story. Colleen was a patient of Paul's. Health Matters with Paul Rosen is this program. We're talking about the 2 highs of health: high blood pressure, high cholesterol, and high blood sugar.
That's
Get
3,
healthy.
actually, Rod.
Did I say 2?
That's the third time you've said that.
Really?
Yeah.
Well,
so
at least
I
I'm
figured,
consistent.
oh my gosh.
Hey, that gets to
if I don't get in there and correct that, people are going to go, what is
to
there are
TOO.
three
TOO.
highs.
There you go.
Three.
That's what we should have clarified at the beginning. Hey, by the way, speaking of that, I'm going to get literary on you, Paul. I'm going to get, right now. A foolish consistency is the hobgoblin of little minds. That's Ralph Waldo Emerson. And actually, maybe he didn't have it right when it comes to health, because as with Colleen there, one of the consistencies I hear with all your patients and with many people having problems with their health is medication. They just take too much medication, and they find when they come to see you that is part of the problem.
There are some updates too on what she said. She talked about chocolate, and I said I hadn't had any chocolate for a while. Well, cancel. The update on that is that at that time when this interview was done, it was very difficult to find chocolate that people would eat that didn't have a verboten concentrated sweetener in it. Now, you can. I eat a 100% cacao, which is basically bitter, but I use Trader Joe's organic stevia powder as a sweetener. So you can get the health benefits of chocolate, which there are many, while not having to consume, a concentrated sweetener, which is, would pretty much cancel any health benefit that the chocolate might provide. So yes, chocolate is available.
In a
100%,
form.
80 to 100%, cacao concentration. That's where the health benefits, generally speaking, anything below that doesn't get you the same health benefit. And of course, it's, as I say, it's really bitter. So a sweetener, organic stevia works
So
really,
in effect,
really well.
you're kind of mixing up your own chocolate. Is that right? You're taking one ingredient and a second ingredient.
Yeah, I literally put some of the stevia powder right on a little section of the chocolate bar, and bingo, bango.
Well, there you go. I can't think of a better recommendation than that, or a more disgusting sound effect ever on this program.
The other thing is,
that's okay.
I want to emphasize that the all-purpose mortality rate, right? The highest mortality rate is when your cholesterol is low, without exception.
And why is that?
Why?
Yes.
Why is the sky blue?
Okay.
Why do the birds sing?
It's a given.
Why is water wet?
Why Do Fools Fall in Love? Frankie
Why do
Lyman
fool-
and the
I was going to get
Teenagers.
to that one.
Well, it's Frankie Lyman. I think it was 1957.
I was
Predates my
gonna
birth
get to that
even.
one.
Well, sorry
Oh, my
about that.
gosh.
Did I ruin your punchline?
No, you were right on the money there.
Get healthy at AccuNatural.com. Get healthy at ACUNatural.com. Shall we go to part 3?
Not quite.
Not quite yet? Here I
I
was all
wanted
ready
to add,
go.
people may ask, well, what kind of fat should I be eating? If you're going to avoid any trans fats, which the federal government, after decades and decades and decades of killing people, finally outlawed it. But, butter, not any butter substitute, butter and olive oil and sesame oil and flaxseed oil and avocado oil, and those are some good, coconut oil. Those are some good substitutes. Although you can't really cook with flaxseed oil; it's too fragile.
Okay, but you outlined some other alternatives. So those are all things you can include in your diet.
And then, of course, saturated fat from meat. No problem whatsoever.
Always
None.
the best
Zero.
news.
Zip.
Always the best news that good red meat is good for you. I like that.
And remember, if you're going to eat meat, make sure that it's free range, free of all, medications like added hormones or antibiotics or, growth hormones or anything like that. And fed with organic feeds, non-GMO. Oh my gosh, the list goes on.
Well, if you can make that happen, do that. Look for.
It's easy. It's in the stores. You can do it. And with the internet now, if you don't have it in your local area, you can order it, and it's worth the extra bucks. Believe me.
There you go. You'll live longer.
Now
be
we
happier.
can go to. Now we can go to part 3 of Colleen.
What was the most challenging part of your nutritional healing program, Colleen?
Challenging as far as going without different foods that I have had in my diet.
Yeah.
It's probably the fruit. And I can hardly wait till the day comes that I can have fruit again. And I know I just have to bring it in and have it tested and see what's what when I can start doing that.
Exactly. And I don't expect that you'll be off fruit for the rest of your life. But the bottom line is, if you had to avoid fruit for whatever length of time to avoid the symptoms that you were experiencing, would that be a fair trade-off?
Oh, certainly. I would continue to never have it again if that's what it is, because I want to be healthy. I want to be well. I don't want to have to suffer with this stuff.
And I think as you see your health diminish, and health being important, especially for you, but I know it is for many people, it certainly is for me. When you see that start to happen, some people just continue to do what they're doing and keep their head in the sand, and other people like you, reach out to try to do something. And I'm so curious as to, do you know how that is? Why that is?
You know why people continue to do what they're doing?
Yeah. Why they continue to undermine their health, and yet they say their health is important too.
That's right. I have a brother who is suffering with diabetes, and we just found out he has a mass on his colon, just found out that on Friday. And I said, so when are you going to get rid of this sugar in your diet? Oh, that'll never happen. I said, man, you could be a new person if you would just change what you eat. But hopefully he will listen to maybe doctors.
Yeah,
I'll just getting more medicine, right?
Yeah, it is a head scratcher, isn't it?
It is, absolutely.
And it's your brother, of course, so you have a soft spot for him, and you want him to do well. But I know it can be very frustrating. I know it certainly is for me. I just don't get it. I don't understand it. But clearly, it's something that happens many more times than I would like.
Absolutely.
Yeah.
Absolutely.
So what were some of the biggest surprises, that you became aware of while you were implementing your personalized nutritional healing program? One of the things you mentioned was that you found soy in everything. Was there anything else that you've discovered?
Yes, I learned the system, the story about canola oil, and it's also in everything, and corn syrups, and which I knew corn was a big thing anyway, and I've tried to avoid that for a long time, but I found that you just can hardly find anything that's already prepared that doesn't have all those toxic things that we should not have in our system.
And doesn't it say something about the whole the whole process, saying something, I mean, if your health is failing, now you know why that might be?
Absolutely. Absolutely.
So you can think of all of the different foods, prepared foods, even prepared foods that begin with healthy ingredients, and how that came to begin the process of undermining your health, right? I mean, share a little bit about that.
Well, like one of my things that I would have oatmeal a lot, but granola was a good snack food that I had all the time. And surprisingly that it has canola oil and not soy, it does have soy too. You can hardly pick up a box that doesn't.
Right.
And then corn syrup is in them all. And I looked and looked and looked, especially my daughter, who is also going to see you, and my granddaughter, they love the same granola. And so they say, oh, there's got to be one. So they found one, and I'll pick it up and say, no, there's soy in it, or there's one of those ingredients.
And one of the things I want to ask you is the other thing you learned, at least that I talk about, I hope, is that food labels don't contain everything that there is actually in a product.
That's right, absolutely. Because if it's a minimal enough amount, they don't have to put it in there.
Right, and so that's also the cross-contamination issue. People don't realize that at granaries there are many grains stored, and so there can be cross-contamination in wheat with soy, or in corn with soy, or in wheat with corn, or whatever. And so that can be a real problem for folks.
That's true.
Yeah,
absolutely.
But the other thing is, what about the recognition that I should say this? What about the proposition somebody tells you, well, it's a lot better if you don't know what's in your food? What would you say to that person?
I say I'd rather know what's in my food, and if I eat fresh and raw, I know, or fresh or homemade, homegrown, whatever, I know what's in it. I don't want other these additives that I don't know about.
There's a couple of other not so foolish consistencies there, Paul. She talked about, for example, soy, the fact that we need to avoid soy. And by the way, that's Colleen, Paul's patient, on Health Matters with Paul Rosen.
Yes. Soy, there isn't anything about soy that you should eat. You might use soy lecithin as a supplement, depending on, your unique circumstances.
But soy is everywhere, as is corn. She mentioned corn, too. Anybody who's read any books by Michael Pollan, who often writes on food-related issues, knows that corn is much more ubiquitous than we imagine.
Oh my gosh. The two crops that are grown with abandon, corn and soy, their products, the food itself, or the plant itself is made into many different kinds of ingredients, from sweeteners to paint to as in the case of soy. Soy is in everything, and because it's grown so widely, it's cheap, and for the most part, people should not be eating soy. I know that flies again in the face of the general notion that soy is a substitute protein for meat, which is absolutely ridiculous. It's just ridiculous.
So while I'm investigating,
we should address the fact that people can always communicate with me at Get Healthy at AcuNatural, acunatural.com, if they have any kind of questions. And note that we are at the end of this weekend, we will no longer be on KUFO. Thank you, KUFO, for your your past support. We will be available on a multitude of platforms, including YouTube and I don't know what are the other platforms. I know there are like 8 of them.
YouTube and Facebook, among others, and of course on the website acunatural.com.
When in doubt, just go to our website acunatural.com, and click on any one of the platforms on the first page. There, and you can hear us, Rod and I, anytime you like, any time of day, any time of night. On any gadget that you've got, iPhone, computer, iPad, whatnot. So
that's all good. Do we want to hear the last part of Colleen's story? If we want to do that, we need to do it pretty quick here.
Well, I think we should do it. I think I'm interested to hear it.
All right. So here's the conclusion to Colleen's story.
Can you imagine any reason why, for example, genetically modified foods should not be identified in a product?
No, I think they always should be identified. My goodness.
How is there any way that you can think of that would argue for the opposite? We shouldn't, it's not necessary.
Oh, no. I mean, I am totally against genetically altered and all of this, even when they hybrid things. I think it's probably when my father grew corn in Nebraska 60, 70 years ago that it was probably already being in the process of being altered.
Yeah, although hybridization, just to make a point, scientific point, is different than genetically modified. What they do in genetically modified foods is they actually put genetic material from species that are not the same. In other words, they'll put animal species into vegetable species, and you don't. I mean, that is not something that occurs in nature.
No, like salmon and corn. Is that make sense?
Yeah, right. Right.
Absolutely not.
Right. That was just sort of a little bit of a link to what we had been talking about earlier. But I was just curious what your take is on it. So, have your efforts proved worthwhile toward achieving the results you had hoped you could have achieved?
Oh yes. My blood pressure's down and my cholesterol's probably about the same, but it's probably because I haven't been exercising very well, and I know I relate to that a lot. Just not been doing the right thing. But I can hardly get my other daughter and her children to come to listen to you talk on Wednesday because they have problem with food sensitivities also.
Oh, my goodness. I hope they come.
Yeah, I do too.
I hope they come. And the cholesterol issue, just as a mention, doesn't really have very much to do with heart disease anyway. So at least for any of those people, it's my understanding from one of the doctors that I have talked with, anything below 300 is totally fine. And the high blood pressure thing going back down. This is all just because you became aware of what changes to make to your diet and what supplements to take specifically to address these barriers to healing. Is that cool or what?
It is, absolutely. Certainly. It's wonderful to be able to do that and not have to rely on Western medicine, So
how has your life changed with respect to things you could or could not do? I think I asked you that question before, and you said, well, not much because you were so healthy.
I thought pretty healthy and still pretty active, and for my age, and but I don't get out and exercise like I used to. I've been really busy with my rentals this last probably 6-8 months.
You're a pretty busy lady. Did you notice anything different in your life? Has anybody else noticed anything?
Well, I just went to a family reunion that I see these people every year, and one of the cousins who is a little bit older than I said, "Colleen, you look so young." And I said, "Well, I am young." And then I start preaching and telling them what I've been doing. And this guy named Paul Rosen has changed my life. And they're just amazed,
And it's so cool because I mean, if I were to tell you that you could live to 150 with high blood pressure utilizing medications, acid reflux using medications, chronic mucus using medications, or constipation using medications, or some sort of aid or some sort like that, versus you can live to 90 with the quality of life that you have, which one would you choose?
I would choose to live at 90 with what I have right now.
Exactly right.
It's the best.
Yeah, it's quality of life that's really important. I think we totally are simpatico on that.
Certainly, it sure is.
Yeah. So, one of the things that I often ask people, and I started it in the beginning, is why should someone attend a talk of mine?
Well, I think just to learn about themselves and how they can heal their bodies without this Western medicine, not having to take medication for this and this and this, and to just be able to eat right and find out your food sensitives and what you can have and what you can't, and be willing to follow that if they actually want to be healthy.
Cool. So I guess at this stage of the game, what the one question I want to ask you is, would you recommend to anyone else you cared about, to come and take and become a participant in this?
Absolutely. I recommend to everybody I see. So anybody that complains about their health or any problem they have, I see you got to go see this guy or come and listen to a seminar.
That's good advice right there. Come and listen to a seminar if there were still seminars, which you're not doing anymore. But Colleen, Paul's patient, she got to a much better place. It sounds like that's what matters most.
Yeah, put that one on hold as far as the seminars goes.
But in lieu of that, AccuNatural.com, ACUNatural.com, get healthy at AccuNatural.com, get healthy again at ACUNatural.com, Facebook and YouTube are places where you can find Paul. And the website, as always, is the best resource, AccuNatural.com. And I'd ask you what's on the show next week, Paul, but I know what the answer to that is.
Pain syndromes like restless leg, polymyalgia rheumatica. Say that 3 times. And joint pain, chronic joint pain, all have one common origin. Learn what that is and how to address it. So the next podcast, that will be the topic. And in the meantime, remember, you ate your way to your illness and you can eat your way to wellness. It's the food, folks. And remember to keep yours fresh.